This is a video to demonstrate how to draw blood cultures only from central lines using the syringe method. This will describe how to draw labs only from central lines that are smaller than 18 gauge or single lumens less than 3.8 French, or if there's an unknown lumen size, lumens containing antimicrobial ethanol lock or continuous medication infusions. If drawing labs and blood cultures from central line at the same time, please refer to the blood culture and labs together from central line's job aid. If drawing labs only from a central line that is 18 gauge or lumen or larger, please see the draw from central lines Vacutainer method. Verify that the patient's collection status is a unit collect, and go to your work list and print your labels. You'll want to gather your supplies, your alcohol pads, sterile 4x4 gauze, normal saline, flush, clean gloves, culture bottles, culture labels, a specimen bag, a heparin flush for non-infusing lines, blood transfer device with a female adapter, 2 empty 10 ml syringes, and 2 stopcocks. You'll explain the procedure to the patient and family. Before you begin, you'll want to evaluate the central line insertion site for complications, including infection, catheter migration, leaking, and phlebitis. If the central line dressing is damp, loose, or visibly soiled, it will need to be changed. Performing your hand hygiene and don clean gloves. You will then start to assemble your blood culture drawing equipment. Place 2 stopcocks together and attach 2 empty 10 ml syringes and a 0.9 normal saline flush to the stopcocks. This allows you to have a syringe for drawing a small amount of waste, a sample, and a flush. To prime your setup, you want to open the stopcock to the normal saline flush and to the patient. Flush through the stopcock toward the end that attaches to the needleless access device and ensure that all air is removed. Turn the stopcock off to the normal saline flush when done. If you have IV fluids running, you'll place all of your IV pumps on hold and clamp the lines that are not going to be used to draw the blood sample through. You'll want to open a sterile 4x4, keeping the outside wrap under the 4x4, and place it under the needleless access device to provide a clean barrier. Prep your needleless access device with a 15-second alcohol scrub and 15-second dry time, or remove the alcohol impregnated cap. Remember, if using an alcohol impregnated cap, it needs to be on for a minute for the antimicrobial properties to work. You'll attach the stopcock setup to the needleless access device. Unclamp the lumen to the line and open the stopcock to the first empty 10 cc syringe and the patient. Do not flush the line first. Draw back until you have a flash of blood as seen in the stopcock where the first syringe is attached. Then turn the stopcock off to the syringe. If the line is antibiotic, ethanol, or heparin locked, be sure to draw back enough to remove the antibiotic, ethanol, and heparin from the line. With the stopcock open to the second empty syringe and patient, draw back the necessary amount of blood required for the cultures, according to the guideline based on the patient's weight, access, and cultures that are ordered. And this information can be found in the job aid online. You'll open the stopcock to the normal saline flush and the patient. Flush with 3 mL of normal saline, or enough to clear the blood from all of the tubing and the caps. clamp the line. Disconnect the stopcock setup from the patient's line. Maintaining sterility of the syringe nozzle, remove the 10 cc syringe containing the blood for culture and attach it to the blood transfer device. Remove the cap from the culture bottle and scrub with alcohol for 15 seconds and dry for 15 seconds. You want to keep the bottle upright. It's very important to clean the tops of the culture bottles, even though you have just opened a brand new bottle, as you can have cross-contamination through the process of flipping off the tops of the culture bottles. And to have the most accurate blood culture results, we want to make sure that the stoppers are clean. Keeping the bottle and the syringe upright, inoculate the aerobic bottle and then the anaerobic bottle. Discard your setups in appropriate containers. Alcohol your needleless access device to reconnect your line or to heparin lock according to the venous access grid, and then reclamp the line. You would either replace your IV fluids or place an alcohol impregnated cap on the line. You'll want to label your syringes and place them in a specimen bag. Remove your gloves and perform hand hygiene.